Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Taraba State Government cancels third-term academic session set September 21st for resumption of schools as states across the country announce resumption after 6 months of lockdown. Former University Vice-Chancellor and Professor of Sociology warns on management of COVID-19 in public universities, suggests safer measures to prevent the spread. And World Health Organization warns of a serious trend of COVID-19 unfolding in Europe, insists on 14 days quarantine period for anyone exposed to the virus. The NCDC has reported 3,442 discharges in the last 24 hours in 9 states, and the FCT, which recorded 3,208 alone, the highest, followed by Kwara at 108, Plateau 70, Kano 27, Delta 9, Ogun 8, Osun 8 as well, 2 in Gombe and 2 in Rivers. According to the NCDC, the numbers discharged from the FCT and Kwara State are community recoveries managed in line with the new case management guidelines. This puts the total number of those discharged now at 47,872. The NCDC also reported 126 new cases confirmed in 16 states, and the FCT, the nation's capital, recorded the highest at 37. 3 deaths were reported also in 2 states, 2 in Edo and 1 in Lagos State. In the meantime, the deployment of surveillance outbreak response management and analysis system, SORMAS, a digital surveillance tool which facilitates real-time reporting of cases of epidemic-prone diseases, including COVID-19, is now complete. According to the head of special duties, the NCDC, digitalizing disease surveillance data will help health workers in different states share information and engage in rapid decision-making in the 774 local government areas in the country, and also rapidly scale up COVID-19 testing capacities. Now, total reopening of primary and secondary schools in Ekiti State will begin in phases over a period of 4 weeks, commencing next week, Monday. This is according to the state governor in a broadcast where Dr. Kaidi Fahimi also announced that tertiary institutions will resume the first week in October. A university don who once headed a public university believes that the management of population for public universities may be a major challenge, suggesting safer approach ahead of reopening.
The population in public universities is a very large population. You have public universities with close to 25,000 students. Then how do you manage 25,000 students that are not living in halls of residence? But notwithstanding, you can still open the university, but you do it in batches. First, let the final year students come in, arrange them in the way that you will keep social, physical distancing. And when you finish with them, then you call maybe 300 level, 200 level, and finally 100 level. You can do it in that way to manage them. And in the case of private universities, it's much easier. The population is smaller. You can even adopt the same methodology.
Meanwhile, the Taraba State Government has asked primary and secondary schools to resume Monday, the 21st of September this year for continuation of academic activities in the state. This has come in 6 months after schools in the state were shut in an effort to curtail the spread of COVID-19. Briefing journalists shortly after a stakeholders meeting in Jalingo, the State Commissioner of Education revealed that third-term academic calendar has also been scrapped for he says school proprietors who have been directed not to collect any monies as fees for third term, but to ensure strict application to the COVID-19 safety protocols, as monitoring teams will be inaugurated to track compliance.
His Excellency, the Executive Governor of Taraba State, has approved that schools that were closed down on the 24th of March 2020 should be reopened on the 21st of September 2020. The following guidelines are to be strictly adhered to by both public and private schools in Taraba State. We will be assuming first term. That is to say, we have skipped that term because of the COVID-19. But however, we have also directed principals and head teachers to work hard to make sure all the areas that we could not cover during schools on radio, television, and online learning and teaching, they should be able to cover some of those areas that were not properly covered.
Now, in Cross River State, the COVID-19 response team has continued its sensitization exercise across the state. The team, led by the Commissioner of Health, Dr. Betta Edu, visited the Cameroonian refugee camp at Ogoja for COVID-19 sensitization, health talk, distribution of face masks, hand sanitizers, and others. Dr. Edu emphasized that while the refugees remain within the state, it is the duty of the state government to continue to protect them, as an outbreak of any disease, including COVID-19, will be a disaster.
We are here at the refugee camp in Ogoja to see them and, of course, to sensitize them on the importance of hand washing, social distancing, use of their face masks, and the use of hand sanitizer, as well as distribute some items to them to enable them adhere to the COVID-19 protocols. Beyond that, we want to ensure that services continue to go on for them at our various primary healthcare centers and secondary facilities where they have been attached to. And we will continue to host them until the situation is good enough for them to return back to their country. But while they are here in our communities in the camp, we would ensure that we provide proper healthcare services for them and all the commodities which they might require while during their stay here.
Today marks exactly 6 months that the Presidential Task Force on COVID-19 was inaugurated with a mandate to coordinate and oversee Nigeria's multi-sectoral intergovernmental efforts to contain the spread of COVID-19. At its briefing today, the Chairman and Secretary to the Governor of the Federation, Mr. Boss Mustafa, reminded Nigerians to be cautious as they prepare to celebrate 60 years anniversary. He described the year 2020 as a difficult one for humanity, calling on the Joint Health Workers Union to let reason prevail over the ongoing strike.
The nation will be celebrating its 60th diamond anniversary on 1st October 2020. This is a landmark celebration, and the programs will be unveiled by next week, Monday. This celebration is also significant because we are in the middle of a pandemic, and we have to be very cautious with regards to the activities associated. It's going to be a low-key celebration. And like I said in my comments yesterday, which I believe substantially taken out of context, when we say it's going to be a one-year celebration, does not mean that every day there will be one celebrative event or the other. Let me once again send a strong appeal to all health workers, particularly JHS members, that the nation can ill afford any further disruption to its health systems. The ongoing strike has been very costly in terms of human lives, but such losses can be avoided. Government shall continue to do its best to push through the negotiations with the unions and hopefully reason shall prevail very soon.
Well, joining us for more is Dr. Japhet Olugboge. He's a public health physician. Thank you for joining us on the program.
It's always my pleasure to be here.
First, I'd like to begin. 6 months of presidential task force on COVID-19. What do you think?
Yeah, well, if you review the activities of the PTF and vis-a-vis the status of the pandemic in Nigeria, well, we can say they've done well. Because if we haven't done well and we have cases skyrocketing, people dying left, right, and center, then we can give them a lot of knocks. So we can't say that the PTF has actually done well.
But we have countries like the US today. They've been speaking about ramping up testing, getting more funds to crush COVID-19 and reopen safely as the country is approaching 200,000 deaths. But for some reason in Nigeria, we're being told that the science says it's not yet a huru. I mean, we're not testing enough. So why are we saying that, you know, the curve has been flattened or maybe there's a bend? So, I mean, what are we working with? What data are we working with if we are not testing enough?
Thank you very much. Also for using some of the time I used when I was there about a month ago. Yeah, it's not yet uhuru, but if you look at the data we have, we are not testing enough. And the data does not actually reflect the true figure out there. Although we can't say for one reason or the other, the burden of the virus has reduced in our society. Well, it doesn't mean that this virus is not out there. People need to subject themselves to testing more. I think there was a fatigue, some form from fatigue about a month ago or 6 weeks ago, which actually reduced the number of figures, the number that we have from NCDC. But it doesn't mean that people are not out there with the virus.
But we can avoid to have that fatigue with schools reopening.
Yeah, sure, of course. I think it's one of the things that we need to deal with because for what it may worth, the combination of preventive measures, home-based care, non-pharmacological care and all that, also might have helped us to get to where we are. But we need to know the true figure that is out there. Yes, people are not dying like they were before, but a lot of people still come down with the virus, they still come down with the disease, even though they may be asymptomatic. So we need to encourage people to test more. And apart from that, government itself should provide the enabling environment for people to be able to test when they feel like testing, when they find one or two symptoms that actually would warrant them from testing.
So we need to change our case management strategy?
No, not necessarily. We just need to maybe diversify our strategy a little bit because if we want to live with the virus, then we should be able to make testing available to people. We should be able to make care available for those who actually want the care.
So the national coordinator talked about the private sector that can help also roll out and ramp up testing, but we know that it won't be for free.
Yes, the private sector, government needs to, I don't know how they will do that, but they need to maybe subsidize or prevail on the private sector to reduce the cost of testing. I coordinate a center where we test. And I know that a lot more people would prefer to come to our center to get the test done free of charge compared to going to the private sector to pay a whooping maybe 45,000 or 50,000 naira. But maybe the disadvantage in the government centers is that the results are not accessible early enough. That's why some people would want to prefer to go to the private sector. But we should find a way to do it such a way that when people test, they can get their results on time. There are 57 LCDAs, LGAs in Lagos now who are supposed to be testing. But government needs to give them the logistic backup, the logistic support to be able to actually carry out testing and then make results available to people on time. So that people who want to observe self-isolation can do that. Those who may need to graduate to seeking care can do that. And those who probably need it for traveling can also do that.
All right. We'd like to thank you so much, Dr. Japhet Olugboge, public health physician. Thank you for joining us on the program.
Thank you for having me.
We have more on the COVID-19 update when we return. Please stay with us. Welcome back. As the world celebrates the World Patient Safety Day, the Minister of Health, Dr. Osage Hanire, at the Presidential Task Force briefing today, paid glowing tributes to health workers in Nigeria, particularly those who have dedicated their lives to the fight against COVID-19. He believes the world won't be celebrating patient safety without the heroic performance of healthcare workers.
We join the rest of the world today to mark the World Patient Safety Day, which was set aside in May 2019 by the World Health Assembly to recognize and highlight the safety of patients under treatment as a global health priority. The theme for this year is health worker safety, a priority for patient safety, with the slogan, safe health workers, safe patients. We are all called upon to speak up for health worker safety, which puts focus on those who provide health care insofar as they too need to be safe and healthy to do their jobs. Confronted as we are with this pandemic, the heroic role of frontline health workers to keep the rest of us safe must be recognized and commended. They work odd hours, endure stigma, they risk infection, and sometimes even their lives.
Let's go over to Bauchi, where the state governor, Bala Mohammed, wants more safety measures advanced in correctional facilities across the country. He notes that admitting those awaiting trial has been a challenge in facilities due to the COVID-19 pandemic and wants the National Assembly to make budgetary provisions for the construction of isolation centres for inmates. He said this when the House Committee on Reformatory Institutions paid him a courtesy visit at the Government House.
Our police stations in Bauchi are full to the brim during the pandemic, and because they are in a very serious ambivalence of admitting those awaiting trial before they are tested and cleared for them to join the inmates, considering the congestion inside the prison. And we believe the only statutory body with that responsibility is the correctional services. It would amount to abdication of responsibility for them to reject them. At the same time, they are also treading on the path of caution, because if they bring infected COVID-19 patients into the correctional services, then it will be a disaster. So I'm asking the House of Reps to come up with a budget to establish isolation centers inside the correctional services, so that even after COVID-19, it can be used for that purposes of isolation. Whoever is going in should be tested. Unless it's found to be negative, he or she should not join other members of those inside the correctional services.
Staying in the northern region, ahead of the National Business and Technical Education Examination, a group development research and project center is providing support to graduating students of Government Girls Science and Technical College, DAPCHI, in Yobe State to mitigate the impact of the coronavirus pandemic. Organizers believe that the project will also go a long way in ensuring the students are rehabilitated and can continue their studies in a safe environment.
DAPCHI community in Yobe State became popular when 105 students of Government Girls Science and Technical College, DAPCHI, were abducted by Boko Haram insurgents on February the 19th, 2018. It is therefore cheering news and a dream come true that these 8 students among the 105 students released are now writing their final year examinations. To comply with the COVID-19 safety protocols at exams, DRPC, in collaboration with Open Society Foundation, is offering support to students of GGSTC, DAPCHI, and 2 other technical schools in Yobe State to mitigate the COVID-19 effect.
So this project is specifically focusing at students that are writing NAPTEP exam for the September-October 2020 session.
We are praying that under the able leadership of our present Commissioner of Education, really this very assistant will contribute a lot. We do write 3 type of exam in this very school because of being science and technical. We write WAEC, we write NAPTEP, and we write NECO. And this very assistant is categorically focused towards a NAPTEP. And for this year, we have 162 students that are going to write NAPTEP.
The students who applaud the government for relocating them to the safer area of Government Girls Secondary School Nguru in the state also called on government not to forget their colleague Leah Sharibu, who is still in captivity.
We really want the government to care about our sister Leah Sharibu because she is in captivity.
There is no doubt the graduation of these students will give hope to other students who might have dropped out of school as a result of insecurity in the region.
Now, the World Health Organization is warning that a very serious situation is emerging in Europe. The health body also repeated that the 14-day quarantine period for anyone exposed to coronavirus should not be changed. According to Europe's Senior Emergency Officer, Catherine Smallwood, the recommendation is based on a scientific understanding of the virus's incubation period and transmission. Here's more on the global update.
The WHO's warning on the quarantine period for the coronavirus comes as it also says roughly 1 in 7 cases of COVID-19 reported to the agency are among health workers, and in some countries that rises to 1 in 3. It has called for frontline workers to be provided with protective equipment to prevent them from being infected with the novel coronavirus and potentially spreading it to their patients and families.
Every day, health workers are exposed to stress, burnout, stigma, discrimination, and even violence.
John? Yes. Meanwhile, in the UK, Health Secretary Matt Hancock says areas of northeast England will be subject to further COVID-19 lockdown restrictions as coronavirus cases surge. People will no longer be able to mix with other households, and pubs will have to close early, according to measures that will be in place from midnight. Residents across the country have been struggling to access the COVID-19 testing system after a rise in cases and demand for the tests.
Earlier this month, Tameside and Glossop.
And in France, several hundred workers at COVID-19 testing laboratories across the country have embarked on a strike action, protesting poor working conditions, piling more strain on the system under severe stress. The strike is said to be disrupting testing in some towns and could drag on if laboratory owners failed to negotiate, just as the government demands more and faster testing to help fight a surge in new coronavirus cases. Spain's Madrid region says it is planning to introduce targeted lockdowns due to rising coronavirus cases. Head of Health Enrique Ruiz Escudero says details of the lockdown will be released on Friday, though he recognized Madrid is in a situation of sustained infection growth. The city accounts for around 1/3 of active coronavirus cases in the country, with a higher incidence in high-density and low-income neighborhoods, mainly in the south of the capital. United States are, however, still...
Well, for more updates, you can take a look at our website. It's channelstv.com. You'll find more stories on the pandemic, plus other stories as well in several other areas: politics, business, sports, Africa, and around the world. Thank you for watching. I'm Millicent Nwaka. Stay safe.